What are transference and countertransference boundaries? Have you ever wondered how emotions play a role in therapy, especially when dealing with trauma? Transference and countertransference are key concepts that help us understand these dynamics. They are especially important in the context of treating post-traumatic stress disorder, or PTSD. Transference happens when a client unconsciously projects feelings or expectations from past relationships onto their therapist. For instance, if a client has unresolved trauma, they might react to their therapist as if they were a past abuser or caregiver. This can lead to strong emotional responses like trust, anger, or dependency. These feelings are rooted in past experiences and not necessarily in the current therapeutic relationship. This projection can significantly impact the therapeutic alliance and the client's progress. On the other hand, countertransference refers to the therapist's emotional reactions to the client. These reactions can stem from the therapist's own personal history or unresolved issues. A therapist might feel compassion, protectiveness, frustration, or discomfort in response to a client's behavior. If these feelings are not recognized or managed, they can interfere with the effectiveness of treatment and potentially harm the therapeutic process. Establishing boundaries related to transference and countertransference is crucial for maintaining a professional and ethical therapeutic environment. These boundaries help ensure that the therapy remains focused on the client's healing journey. They also protect both the therapist and the client from emotional entanglement or confusion about roles. Key strategies for managing these boundaries include being aware of and self-monitoring emotional responses. Therapists need to recognize their own biases and feelings without acting on them impulsively. Seeking supervision or consultation is another important step. This allows therapists to process their reactions and maintain objectivity. Setting clear professional limits is essential. This means maintaining appropriate roles, avoiding personal disclosures, and establishing limits on the therapeutic relationship. Sometimes, discussing transference and countertransference openly can provide valuable insights into a client's inner world. However, this must be approached carefully and professionally. In the context of PTSD treatment, where clients may have heightened emotional sensitivity, managing these boundaries becomes even more critical. If not handled well, it can compromise trust and even re-traumatize the client. Conversely, effectively managing these dynamics can strengthen the therapeutic alliance and support healing. In summary, transference and countertransference boundaries are vital for ensuring therapy remains a safe and effective space for healing from trauma like PTSD. By understanding and managing these emotional dynamics, therapists can better support their clients on their healing journeys.